Well, hello there, beautiful rays of light. Thank you for joining me on the Hill Spot podcast. I am Nikei S Salas, your host, spiritual guide, well-being educator, and all-around inspiration giver. This is about promoting healing. We want to promote healing so we can live better. When we are doing better, we are able to enjoy our lives. And how do we do this? We do this by positively affecting the different aspects of the self, whether that be mentally, physically, emotionally, and the spirit. The spirit loves that. It goes along for the ride. So make sure you subscribe so you can be notified of upcoming videos and life teachings. Thank you for joining me. Peace and blessings.
Well, first off, I just want to say Happy New Year to you all. We made it to the other side, a new year 2025, and I am claiming, I am believing that it is going to be a great year for you. So let's get right into it. So, first off, let's talk about what is pre-diabetes and what is diabetes, okay? Disclaimer real quick. I am not here to give medical advice. I am going off my own knowing, my own education, the education I have received not only from school and so forth, and back when I worked as a nurse, and I still do research for my business now, my well being education business, but also the education and the knowing of myself. That's where I speak from. I am a believer. I am a person that practice what I do. They used to say, you heard of that saying, practice what you preach. I like to say, practice what I do. So I am speaking from that. I am also encouraging that whomever that is taking these teachings do so with consulting their self and their favorite health care practitioner. Okay, so now that we got that out the way, let's get into it. So I know you all have heard of diabetes, right? The old folks used to call it the sugars. Diabetes is something, and I don't want to get real technical, right? I want to keep it very simple, though I know you all know a lot of this as far as hearing about diabetes and so forth, but I want to just go a little bit further into what it means and what it does to the body. So, diabetes is a condition that is diagnosed by a healthcare provider, a physician, right? And this is usually chronic condition, meaning something that is longer than just a day or so, something that has been happening consistently, right? So, diabetes again is diagnosed by a medical provider or physician, and this is done. So, one of the ways that they do so is checking your A1C. When they check your A1C, your blood glucose levels, they are doing so after a person has fasted. That means, of course, they didn't eat overnight or for a while, depending on what the doctor suggests. And they're seeing how the body is reacting to um, lowering the blood glucose. Not only that, and then also too, it's letting them know how insulin is working in your body. So that's just a simple definition of that. Pre-diabetes is exactly or similar to what it is saying. It is how your blood glucose is acting in your body without a diagnosis. That's the simplest way I can put it. Pre-diabetes is usually not diagnosed. Now, you can, or a person can go to a doctor, and a doctor may say that a person is pre-diabetic. They're just basically saying that, hey, if this keeps on consistently, right, like we said about diabetes, this is what can happen. Now, like I said before about something being acute and something being chronic, right? These things can be reversed, you all. Yep, I said it. I said it. I said it. These things can be reversed. And I say this again for my own knowing. I don't know if you all had the chance, and I'll leave the link below in the description if you have not heard me talk of my own knowing, right, of what I have experienced of being in the past a pre-diabetic. And I reversed this, changed this from lifestyle changes. And when we go see our favorite, and I say favorite practitioner, I'm saying so with the hope that you are able to spend time with this person, that they can educate you on not just putting a diagnosis on someone, right, or on you, but educating to you of how that disease process may be working, right? And I'm going to also um, say in the defense of many healthcare providers and physicians, unfortunately, you all, they are not allowed the time to really sit down and talk to many patients. And I say that from my own knowing. That's when I will work in different clinics. Doctors will have, and a lot of times, especially if they're working with a certain healthcare system, they will only be allotted a certain amount of time to get in and get out, right? And that's why I say it's best for us to do our own educating, right? Our own learning of ourselves, our bodies, right? Because who is the best advocate and the best speaker for you? You, right? So when we go see our favorite physicians or healthcare providers, we should keep that knowing, or keep that within us, that, hey, this person is only able to get a glimpse, a screenshot as to what is going on with me. But it's up to me. It is up to me to take care of myself. So, again, let's go back to prediabetes and diabetes. Diabetes is diagnosed, and that is from consistently having high blood sugar levels, and pre-diabetes. That's something that's just they kind of telling you or saying to you that if this keeps on, this is what will happen. And this is reversible. I say this not only from my own knowing, but from those I would help take care of in the past, right? And other people that I do know that were able to reverse the effects of diabetes, because type 2 diabetes is something that comes on from consistently practicing a certain lifestyle. And that lifestyle could be something that is helping the blood sugar to stay high, right? And that could be anything. That could be the foods we are eating. It can be the effects of stress, which stress is a main, one of the main, unfortunately, causes of many diseases, especially in the USA, and different things that we are exposing ourselves to, right? Whether it be our environment in our home, that can be the people, which can, yes, cause stress, the emotions that we feel, those all these different things as part of our lifestyle. And when we change these different routines in our lives, it creates a style, or it creates what we want to happen in our body. And that is how the disease of diabetes can be reversed. Just like how it comes on from consistently doing something or being in a way that is allowing the blood sugar to be high, we can reverse it by doing the opposite. And it could be, like I said, different things. Like I told you before, for me, some time ago when I was experiencing this, it was because I was not moving enough. I was in a high stress job. That's one of the reasons why I left nursing. And because of the high stress that I was experiencing, I was making not the best decisions for myself, whether it be food, sleep, and so forth. And that's another thing. Our sleep, you all, our sleep is so important. Oh, I know we be looking forward to laying down in that bed, but it's not only, yes, to, get away from the woes of the day, but allow our bodies to rejuvenate, to recoup all that has been done throughout the day. Rest is very important. Rest is very important in balancing our hormones, and that it also includes balancing insulin, or helping to um, decrease the effects of what that does. Because insulin is still secreted throughout the day and even at the night. But the thing is, we don't want to overwork that, right? We don't want to overwork our pancreas, because even if we're going through these different things throughout the day, and our body will like, yeah, it might say throughout the day that it's okay, but at night it's like, ooh, child, that was a long day. Now we got to try to fix everything that was done throughout the day. And when we are consistently practicing these new lifestyle changes, these things, these habits, these routines in our lives, it reverses the effects of diabetes and pre-diabetes. So when we hear of the different medications that help reduce inflammation, that's exactly what it's doing, you all. It is putting something within us. It's being injected. What I speak of is the different medications that they have out there now for weight loss, for prediabetes, for diabetes. And again, this is not medical advice. This is just from my own knowing, and it's just education, right? Because maybe you may not know how this works. These medications are being given or taken to reduce inflammation. And again, inflammation can be brought on from stress, different kind of stress, because stress isn't just like, oh my God, road rage, or these different things that we go through emotionally and mentally, but it's a stress of different things, the different elements in our environment. And that includes our food, right? It includes how we are sleeping or not sleeping. Everything we do, you all, is part of our lifestyle. And because of these different things, or of these different things, they can either increase inflammation or decrease them. So when these medications are taken, it is to decrease inflammation, again, whether it be from food and different things that we are taking on or consistently doing in our lives. And again, you do and choose what is best for your body, what is best for your life. Me personally, and again, I spoke about this before, um, I chose this time, when I got better with my weight loss journey, which was really just being better just overall, right? Because I love to travel, I love to do different things, and with my business, I wanted to be better, not only for myself, but as for the people that I help service. I chose this time to do it all natural, because in the past I have done many different weight loss medications. But once I said to myself, okay, I'm not doing this, I want to do this in the best way that's for me. Because before I was doing it as quick fixes, and unfortunately, it would backfire on me, where I would have to keep trying to keep these things up, the different medications and so forth that I've taken in the past. I just kept going backwards. Whereas with this way, just taking my time, doing lifestyle changes, I have been able to keep the extra weight off, not only physically, you all, but mentally, emotionally as well. So that's all for today. I thank you all so much for joining me in this time, in this space. Again, I am Nikei S Salas, your favorite well-being education, a well-being education giver and inspiration giver. Until the next time, I wish you all well.